Hello, everyone, and welcome to today's presentation. I would now like to introduce Kerri Murray, ShelterBox USA President.
Thank you so much, Jessica. Hi, this is Kerri Murray. It is an absolute privilege to serve as the president of ShelterBox USA. Thank you so much for participating in this morning's webinar. We are going to be talking about the importance of shelter in reducing the spread of COVID-19. I do want to encourage everyone to ask questions, so there is a chat box. Please chat in your questions during the webinar and I will work to answer as many as possible. Now, ShelterBox continues our humanitarian work. It is a global humanitarian effort. It has been 2 decades in development, and I will tell you that COVID-19 has added a massive complexity onto the humanitarian aid work of ShelterBox and humanitarian aid organizations around the world. But we are adapting and scaling our work, even in light of COVID-19, to help the most vulnerable, and really with a focus on mitigating the spread of this virus and continuing our services in the safest manner possible. So today I'm going to take a deeper dive and we're going to look at the work of ShelterBox. We're going to talk about the challenges that communities are facing around the world with COVID and really how we are reacting and how we're continuing to respond and actually scale in light of this virus. Now, coronavirus is one of the biggest threats to humanity right now. It's affecting every person on the planet. And like all of you, ShelterBox is really concerned about the impact that COVID-19 is having on our lives and particularly really vulnerable populations around the world. And it is spreading around the world, and it's particularly virulent and highly contagious, as all of you know. So we're working really hard alongside many of our partners around the world to continue to provide emergency shelter now more than ever. So I want to share with you a World Health Organization map. It's looking at the number of reported COVID cases between a 1-week period, and it is May 19th to May 25th. Now, we know that this virus has swept from China throughout East Asia. It jumped to Europe and the United States, and cases are now spreading in Africa, South Asia, and Latin America. And as you can see in the darker parts of that map, you can see that's proportionate to the number of cases. So those darker colors, United States, Brazil, which has been in the news quite a bit over the past week, has seen a real increase in the number of cases. But as an outbreak of COVID-19 in humanitarian context, there are parts of our world that are particularly vulnerable. And we're going to talk about some of those places like Syria, places like Bangladesh, the Lake Chad Basin of Africa. This virus is going to be particularly devastating, and it may far eclipse the impact to human life that we've already experienced to date. So there are disparities with this disease, and we know that access to healthcare is so critical. If you look at a place like the Democratic Republic of Congo, there are 31 ventilators for the entire country. When you look at test kits for COVID in the US, there are about 38,000 per 1 million people. In a country like Yemen, there are 30 tests per million people. So in these countries, if there's a widespread transmission of COVID, people will die at a much larger scale. Now, in the context of displacement, and that's what we focus on at ShelterBox, is people who are displaced in our world due to conflict as well as disaster. Now, right now, generally in our world, there are 88 million people across the globe that are displaced. It is more than any other time in recorded history. And that number is growing each and every year. So I'm going to share with you some data, and I have 2 different pieces of data to share with you. And this is from the Internal Displacement Monitoring Center. And this first one is looking at the countries with the most new displacements by conflict and violence in 2019. And so you can see countries like Syria, the Democratic Republic of Congo, Ethiopia, all of these countries accounted for more than 1 million new displacements each. And there were 33 million new internal displacements across 145 countries in 2019 alone. A lot of these are caused by armed conflict, and they're in low and middle income countries. Now, looking also at disaster, disasters also causing a tremendous amount of displacement. So there were about 1,900 disasters in 2019. It triggered nearly 25 million new displacements across the world. This was the highest figure since 2012, and it was 3 times the number of displacements caused by conflict and violence. Most of these displacements took place in East Asia, the Pacific region, looking at things like cyclones, typhoons, earthquakes. And so it's massive when you look at places like India, the Philippines, Bangladesh, and some of these regions. And if you saw last week with Cyclone Amphan, massive displacement, tens of millions of people affected by that cyclone, which hit West Bengal and Bangladesh. So we are particularly concerned about people who've been displaced. Now, looking at one of the populations that we serve, and it's refugees and internally displaced people, while COVID is absolutely a threat to all of us, the virus is particularly a threat to people around the world who are fleeing and struggling just to survive each and every day. And that's because refugees typically are living in refugee camps. They're in makeshift settlements. They are particularly vulnerable. There are tens of millions of people who are right now living in overcrowded settlements. We know sanitation is poor, social distancing is impossible, and access to services is so limited. So they tend to live in very crowded collective centers and transit centers as they await processing and as they await getting a tent or a shelter that they can live in with their family. So they're often held in collective centers and units where they're stuck all together. So if you can't isolate with your family and you don't have sanitation or hygiene, you can't keep your hands clean, you're so much more likely to spread this virus. So without significant mitigative actions, this disease is going to spread. Now, to put some of the crowdedness of the camps also in perspective, where this virus originated was Wuhan, China. And there was a severe outbreak. That's a part of our world that has a population density of 6,000 people per square kilometer. Now, to contrast that with the Rohingya refugee camps, and we're looking at a photo of Bangladesh, that population has a density of 40,000 people per square kilometer. So the more people crowded into an area like a camp, the more rapid the spread of COVID-19. And that combined with an inadequate number of healthcare providers could really have devastating consequences. So there has been this understandable focus on the increased healthcare strain, right? And the need for increased healthcare resources across the world, but also in developing countries. But without the measures to help these families isolate and promote good hygiene, healthcare providers are going to be quickly overwhelmed with the caseload. So COVID-19 has been impacting hospitals and healthcare centers already in less developed countries, and much more severely than developed countries. So there's higher levels of vulnerability already because of malnutrition, there's poor health. And so that means that people are at risk of developing severe life-threatening symptoms and as a result of COVID-19. So the pre-existing humanitarian needs are as acute as ever. And COVID-19 is like adding a disaster on top of already a massive crisis. So, also due to the measures that have already been put in place around the world, limiting the movement of people and goods internationally and within borders, supplies of humanitarian aid to conflict and disaster areas are already faltering. And I will tell you, COVID-19 has added a massive logistical complexity to nonprofit organizations, and that includes ShelterBox. And, it is something that we are fighting each and every day, but we're committed to fighting the fight and reaching these communities. But Added onto that, the global economic crisis that's occurring because of the pandemic just further endangers the continuity of operations of organizations like ShelterBox to access financial resources and do the work. So we've been working really hard at ShelterBox to adapt and scale our work, and we know that we have an absolutely critical role to play to spreading and mitigating the spread, I should say, of COVID-19. And so as a result, ShelterBox has come up with a response strategy to the global COVID-19 pandemic. And as we face this pandemic, we know that our aid has never been more critical in our history. It's so important right now. So our top priority is following core humanitarian principles, and that's doing no harm, first and foremost. But we're adapting, we're scaling our work to serve displaced communities that are most at risk of being devastated by COVID-19. And in most of the places that we're working, only essential and life-saving humanitarian projects can continue right now, and ours are continuing. But we've developed three strategic objectives that we are really focused on as our true north each and every day right now during the pandemic. One is support the efforts to delay the spread of this virus. Two is reducing the negative impacts of COVID-19 on health and well-being by continuing to respond to the pre-existing drivers of displacement. So continuing the work is critical. And third, it's advocating for the maintenance of humanitarian access to communities that are affected by COVID-19. So how is ShelterBox flattening the curve? A really good question. So there's a lot of talk out there about the importance of healthcare, a lot of talk about the importance of hygiene, but the three essential components to mitigating the global spread of this disease is healthcare, hygiene, and shelter. And shelter is the critical component towards the prevention and mitigation and recovery from this crisis. And I think every person on this webinar today can probably really relate more than ever before to the importance of their home and the importance of shelter to your health, to your safety, to your well-being, to your hygiene. And adequate shelter will reduce the spread of COVID-19 and flatten the curve. So it allows the healthcare providers time to prepare and care for those that are infected. And it's really, really important that we get shelters to people where they can social distance and they can self-isolate. So this is some of the humanitarian aid, essential aid items that ShelterBox deploys. We provide a variety of shelters and basic essential household supplies to maintain better hygiene and set up household when you've lost everything. So our core work, as you know, is the provision of emergency shelter and supplies to help you through a crisis. It's through disaster, conflict situation, and now both of those with the addition of COVID. So here's an example of just some of the shelter and aid items that we provide around the world. And our items provide opportunities for families to social distance. So we're going to talk about that as it relates to the shelters, shelter kits, tents, and then other items to maintain better health, better hygiene. And every single disaster and crisis that we respond to at ShelterBox is different. And so we put together very custom aid packages based on the specific needs of families in each situation. And that's what we're doing. And it's different in every place that we're working right now around the world. But the center of gravity never changes. It's to ensure families have the provision of shelter and basic supplies to enable their self-recovery. This is an example, a great example of who we work to serve. This is 20-year-old Mustina. She lives in a host community in the far north region of Cameroon. There has been incredible displacement in the Lake Chad Basin of Africa due to extremist violence, many Nigerian refugees fleeing into Cameroon. She left her village because of the insecurity. She left, as you can see, with her baby, and she is struggling to survive. And what she needed most was basic essentials like a shelter for her family and basic things like cook sets and items to set up household. And we often get thanks from our beneficiaries around the world that we recently received her story. But she says, I want to give a thank you to all the people who cared about me. Thank you for supporting this and for your attention to my family. And Mustina and her son are really indicative of the people we're working to find in the world who need our help. So right now at ShelterBox, we're supporting efforts to delay the spread of coronavirus. First and foremost, it's about the provision of the shelter, the center of gravity for what we do. And in densely populated settings, so we are working in urban settlements, it could be places like Syria, Northwest Idlib, also camp settings, and shelter has a really vital role in enabling households to implement mitigative factors. And so we're working to support the efforts to decongest collective centers, transit centers, and make shelters much more livable, where we can also assist healthcare organizations, which you'll learn about where appropriate. So these are examples of our standard relief tents. These help people keep distance from each other, and it's absolutely vital right now that we move people from overcrowded camps and centers to more private spaces where they could limit exposure to the virus. And so some of the things that we're looking at as indicators right now is the number of beneficiary households that we can help. How quickly can we move people into individual shelters, alter their living arrangements in line with the public health advice of those particular governments. We're also improving access to hygiene items. So in many of our aid packages right now, we've adapted. We've added things like soap. We're adding hand washing basins. This is a picture from Syria, and we are adding and scaling our work there, adapting with hygiene supplies. So in addition, we're adding things like educational materials and training and having a health advisor at distributions to really educate the community on how to maintain good hygiene during this time. So hygiene, critically important. We're also promoting better health and supporting healthcare organizations to really restrict the spread of COVID-19. So a few of the other aid items that we're deploying that you should know about that are absolutely instrumental right now are things like cooking equipment. So cooking equipment, restoring a routine, having your own cooking equipment where you're not sharing and you can prepare food individually without having to go to crowded food distribution sites or share meals with other families. Critically important. Also, things like sleeping mats, really important to help families get some rest. Mosquito nets, as you see here, helping to prevent against vector-borne disease and illness during this time, overall maintaining much better health. Water filters, a key thing that we do at ShelterBox is the provision of water purification units. These, again, really helping families have access to clean drinking water and the ability to practice better hygiene. We are also working with healthcare facilities, and this is again adjunct to what we do with the provision of emergency shelter. We often get asked by healthcare facilities to help them, and this happened in the case of COVID-19. And this is an example of our facility in the Philippines. We are registered as a nonprofit, ShelterBox Philippines. It is Cyclone Alley, an area that is erupting consistently with natural disasters. But with COVID-19, the medical facilities are becoming overwhelmed. So we were asked by the Eversley Sanitarium, it's a public hospital in Cebu, to help create extra spaces to treat vulnerable patients in both emergency areas and triage areas. And this was going to help the hospital from becoming overcrowded. So this is one example of how our aid is supporting the hospital and families during the crisis. But the hospital staff have used the aid to set up these individual extra spaces around the hospital, just like this one that you can see in the photo. And these are shelter kits, and we deployed them from our warehouse in the Philippines, but they're tarpaulins, they're ropes, and also household items that, again, help decongest that space for the healthcare providers. So these are two of those healthcare providers Nancy is the head of medical services from the hospital, and they were very grateful that these facilities were set up adjacent to the emergency room, and that the cases and patients that were coming to the hospital could pass through that triage area, serving as like a holding area or a temporary accommodation. The patients who then need a referral, so they're getting referred because they have COVID and they need to go to an isolation ward, or they get a referral to another hospital. So it really helps to limit the pressure on that facility. Now, in addition, at ShelterBox, we're very much modifying our distribution practices and working to do no harm, but also really working to make sure that we can continue to actively respond. So we've adapted a lot of our distribution methods, and we're really specifically trying to meet these COVID-19 recommendations. And that includes the use of things like PPE. So for the workers, it's things like masks, it's gloves, it's sanitizers, it's hand washing stations like you see here, which is so critical. And so we're going to talk about ways, in addition to sanitation, that we're trying to social distance and isolate families. So we're making sure we do no harm. But this is one example. Now, I can't underestimate enough the importance of continuing our operations during COVID. And partners play a massive role in the ability of ShelterBox to reach vulnerable communities around the world. We never go it alone. We work with partners. A really long-term partnership in the DNA of what we do is Rotary. ShelterBox is the official project partner of Rotary International in emergencies. They are a tie that binds our work each and every day, from logistics and supply chain support to volunteers that serve to help scale our activities. They are critical. And we have several other partners around the world that we're working with. This is an example of one of our partners, Aida Relief in Cameroon, that really helps us, and they help us on the ground, really for information sources, logistical help, scaling our response. And as you can imagine, during the coronavirus pandemic, travel restrictions have meant that collaboration and partners are critically important. Every nonprofit is saying that same thing. We are working together more than ever before. And disasters don't wait. So, many families around the world are facing disaster in addition to this new and deadly threat of COVID. So the need for our support hasn't gone away, it's only increased. So our work with our partners is also increasing at the same time. This is another one of our awesome partners. This is Relief Aid. They help distribute our aid in Syria. The longest piece of our work has been to the Syrian refugee crisis, half the pre-war population displaced, massive wave of displacement, 1 million new people displaced in northwestern Syria, in Idlib alone, since December of 2019. Now our partners continue to get aid in to families who are displaced, but they're taking a lot of extra precautions against coronavirus. So as you can see, wearing masks, wearing gloves, lots of hand washing, and making sure they're maintaining a distance from the people in the affected communities. Really, really important. We're also in Syria, we're taking the coronavirus related guidance, which means in our distributions, again, so hand washing basins, they're now an essential part of our household aid package. Also things like sanitation. So we're ensuring that we're sanitizing the surfaces, everyone's wearing PPE. And then also, in addition to that, really modifying our practices so that we're doing smaller distribution days. We are not serving hundreds or thousands of families on one distribution day. We're doing dozens of families. And as you can see from this picture, this is a recent distribution in Somaliland. And this is how we're training and how we're distributing the aid. And you can see they're maintaining very much a social distance, and we're limiting the number of people that we can serve each day. Again, do no harm. So it's critical right now that ShelterBox maintains our ability to actively respond to communities, and that's both in conflict and disaster. And we're working really hard to do that. I want to share with you one of the beneficiaries, and this is Abu. And he told our teams at Relief Aid that if the virus spreads, it will be a catastrophe. I need a kitchen set for my family so that I don't have to borrow from someone else or lend my goods to another person so that the infection doesn't spread. All I can do is keep my family away from people and inside the tent. And that is so true. Social distancing, maintaining better hygiene, having your own equipment. This is really basic aid items, but they're really essential and can be life-saving in these communities that we're working. So where are we working right now? I want to give you an idea around the world of current deployments. This is changing, it seems, each and every week. But right now, again, long-term deployments to Syria, working in Ethiopia, Burkina Faso, massive wave of displacement in the past year, Cameroon, Nigeria, Somaliland, Tanzania, also Vanuatu. We're going to talk about Cyclone Harold, and then now monitoring and assessing Cyclone Amphan, as well as the Philippines. So I want to start with Cyclone Harold because this was a disaster that should have made headlines around the world, and it did not because of COVID. And it displaced tens of thousands of people in Vanuatu. It's Category 5. And it made landfall in early April, and it brought widespread devastation to communities in the north and the provinces of places like Sanma, Malambo, it affected 90% of the buildings. So you had buildings that were 90% damaged or destroyed in Sanma. And luckily, Vanuatu is COVID-19 free, and the government wants to keep it that way. But as such, access to the country is really limited right now, and they're not allowing humanitarian aid organizations in. And so we are very fortunate that Vanuatu is an area that we've worked in the past to previous cyclones. So we are not sending our volunteers to the airports or exposing the island to any additional risk. We're actually working through local partners to conduct assessments and distributions while we send our aid in. So I'm happy to report that the aid arrived in Brisbane and is already on a boat, and it's headed to Port Vila. This week it has been in transfer and it arrives next week. And our partner on the ground is Kerri Vanuatu. And they're working on conducting the assessments right now, and we'll be working with them on trainings, and they'll be doing the distribution and then our monitoring and evaluation of those. We're sending shelter kits. We're doing a lot of household items, and we're going to be doing a lot of good work in Vanuatu that really needs our help, and very few humanitarian actors that are responding because of the COVID crisis. We're also working extensively in the area of Cameroon, and this is the Lake Chad Basin crisis. We work in a camp in Cameroon called the Vanuatu camp. And this is a camp that is serving tens of thousands of primarily Nigerian refugees who have fled Boko Haram violence and have just really experienced unimaginable tragedy to arrive at this camp. And when they arrive at the Vanuatu camp, you are sitting and living in a transit center, a collective center, and it could be a period of weeks or months. No ability to social distance, no ability to isolate. So we are working really hard right now to maintain our shipments to these areas, both on camp and off camp, so that we can provide tents and household items so people can social distance and we can move people out of collective centers quickly. Now, we are the only provider of tents for new arrivals to the camp at Vanuatu in Cameroon. So as you can imagine, our work there is really, really important right now. So here is an example. This is one of our recent beneficiaries. It's Wandala, and she has been staying in a host community and received a shelter kit from ShelterBox. She's in the far north region, and she's pictured with her grandchildren. And Her son and his wife both were killed when the terrorists attacked her village. And so she is the caretaker for all of these grandchildren. And so it's basic things like shelter and supplies that she needs to better care for and enable the recovery of her family. So the work, as you can see, is so important. Also, another part of our world, Burkina Faso, there has been nearly 1 million people who've been forced to flee their homes, again, due to extremist violence. And most of the families are living with friends, they're living with other family members, some are in overcrowded homes, some are in camps, many are living under trees. And so the insecurity and instability in this area has definitely made it really difficult for aid workers to reach some of these folks, but we are committed to helping in this displacement. We have a German NGO we're working with called HELP, and we have a project that we're working on now that is about really decongesting those overcrowded spaces and the camps and the urban settlements and enabling people to social distance and isolate. So a really critical piece of our work. For this emergency aid arrived into the port last week. It's right now in a train in country and it's due to arrive in early June. So we'll keep you posted on this, but this is another critical and new project for us to help in Burkina Faso. Somaliland, a part of our world that has experienced really incredible drought, population that's mainly nomadic pastoralists on the hunt for food and water, and massive waves of displacement in an area that we've been really focused on providing shelter kits as well as household items too. We're adding hand washing stations at our distributions, and we're working with our local partner ActionAid to distribute this aid to families who are still unable to return home. We've been limiting distributions in this area, so we're doing 50 people a day to minimize physical contact and again, maintain some social distance. Massive storm that hit last week. It was called a super cyclone, Amphan, and it devastated the coastal areas of West Bengal and Bangladesh. It was the most powerful cyclone ever to form in the Bay of Bengal, and it made landfall a week ago Wednesday. And this really it devastated and caused massive waves of displacement. In some areas, it's in the tens of millions of people who've been affected, hundreds of thousands of homes damaged or destroyed. The information is always the premium in these disasters. I always say, you know, there's an urgency to act. There's never good information to act on. Right now, we are working with operational partners in country. We've worked extensively in Bangladesh to really look at what the shelter needs are going to be. We know that the shelter needs are massive, but we particularly look at the gaps. Where can we fill in the gaps with the most vulnerable? And we are looking at that right now on where, how many. We know that many families in Bangladesh are now homeless and are likely to need our help. We've worked extensively in Bangladesh and Cox's Bazar with the Myanmar refugees, as well as in the north with the flooding. So again, a disaster that caused widespread damage that we are going to be looking to see how ShelterBox can help support. So measuring our impact, critically important that in addition to doing no harm, continuing our work, that we measure, we map, track, and measure everything that we do. And while there's no vaccine available right now to end COVID-19, the provision of shelter and basic household items to allow families that live in congested areas and enabling them to move into single family units, practice hygiene is absolutely essential. So we are looking at everything that we do and how we distribute, how we mitigate the pandemic risks of the daily lives of the people that we're serving. And so, you know, as a result, you know, we're really looking at highly dense, low-income communities. How can we help enable overburdened healthcare facilities? How can we help them better manage the pandemic? How can we help them reduce the overall mortality rates in the region? And so we're really looking at how we can map and track and measure the impact we're having in these communities. But the work is so, so important right now. I do want to announce to everyone, I know many people have asked, even on this chat, how can they help? There's a lot of ways that you can help the organization. We are trying to raise awareness of what we do. Right now, it's been incredibly difficult. The whole world's been affected. Many individual supporters we know that have been affected, but we do have, if you want to get involved, there are ways. And one is through our COVID-19 fund. All of our responses at ShelterBox this year have a COVID-19 mitigation factor. And we know that we need to adapt, we need to scale. Our work is costing more, it's more logistically complex, but we are committed to these families. And we have a dedicated fund that is going to enable us to scale our work. It's on the website at shelterboxusa.org. On the donation page, you can give directly to that fund. This is really, really important. We are approaching hurricane season. It starts June 1st on Monday. We know that our work will only pick up with more natural disasters, and obviously there's a lot of conflict-related displacement, but we can't do this work without support, and our work has never been as important as it is right now, and it's truly life-saving to the families that we are helping around the world. A few recognition and notable mentions I want to mention to you. Again, we are the official project partner of Rotary International in disasters. We couldn't do this work without Rotary. They're a huge tie that binds. Also, Charity Navigator. I know many of you look to Charity Navigator on organizations that are effective and efficient. We've achieved its highest 4-star rating, and we are now on the list of the places to give who are responding to COVID-19. In 2018 and 2019, ShelterBox was nominated for the Nobel Peace Prize, and it's for the quiet work that we do every day, which is helping families in some of the most extreme conflict zones in our world. So that is just a privilege to be nominated for that. I'm going to take some questions, and I want to share with you just a few pieces of information. And this includes how to reach out to us. So my email is here, kmurray@shelterboxusa.org. You know, as we work and think about the future, and we look and think about COVID-19, I know it feels overwhelming. It feels absolutely overwhelming to all of us. And many of us feel very vulnerable for our families, our friends, our communities. But I'll tell you, at ShelterBox, we are committed to tackling these displacement problems. We are committed to helping the most vulnerable. And it's one disaster at a time. It's often one camp at a time. It's one makeshift settlement at a time. It's one community at a time. And it's one family at a time. And we are going to fight this, and we're continuing to adapt and scale our work. And never has it been as important as it is right now. So with that, I'm going to take some questions. I'm also going to ask that you help share and spread the news and spread the word. We don't advertise. A lot of this is a grassroots effort. So if you can participate and make a donation, that's great. But if you can also share and raise visibility, whether it's following us on Facebook and sharing our updates, or telling a friend and sharing our work with others that you know. So there are a few questions I want to answer, and I had some great questions from our webinar yesterday too. So I want to start with that one because I thought that was a really great question around women and children. How is ShelterBox helping particularly women and children? I hear that domestic violence is increasing. I will tell you, ShelterBox is an organization that fills gaps, and the need is massive. And as you know, we can't fill the entire need, and neither can all humanitarian organizations and governments combined. We're here to fill gaps, so we have to prioritize the most vulnerable, and those are often women and children. Now, our tents, our shelter kits allow women, allow children to isolate. They give them a safe place where they can have better hygiene, they can stay safe. And we do work to help the most vulnerable. They're often women, they're often mothers, they're often children, they're often disabled, elderly and often, child-headed households as well. And as you saw in the case earlier, they're often grandmothers. And so we are working to really try our best to reach the most vulnerable. Okay, some more questions. Once initial supplies are exhausted, is there a mechanism to replenish? Okay, great question. So ShelterBox is an aid organization that pre-positions supplies all over the world. So we have aid pre-positioned from the International Humanitarian City in Dubai to Panama to ShelterBox Philippines. And so we do have inventories to draw down upon. Really critical that we replenish those inventories. So after disaster, the items tend to last long enough to cover that gap until families can get back in a home. But places like Syria or the Lake Chad Basin, we work in subsequent project phases. So while we are distributing items right now to new families, we're also working to secure funding to help replenish that stock for those who are going to need it due to wear and tear, or who are going to be displaced during a wave of displacement, say, to those camps. So we've definitely adapted, and in camps, we'll move people from temporary shelters, often tents, and even into mud brick homes or shelter kits if they're really there for the longer term. So that really varies. I had a comment I wanted to share with you, and I really love this one. I'm in the 3rd grade, and I'm helping people know about #ShelterMaker for my school project. I'm also donating my donation allowance to ShelterBox. Thank you for what you do. I'm telling you, it takes a village to do this work, and we are so grateful to you, our youngest probably humanitarian on the line, for what you're doing to help. I'm definitely inspired by you, so thank you so much. Another question, how many Indigenous Americans have been displaced by the pandemic? Okay, really good question. I was looking at this recently, and I know according to the UNHCR, Indigenous groups have been displaced, across the world, I think from Brazil to Venezuela to Colombia, and they're definitely in the thousands. They face some really overcrowded conditions, poor sanitations, and, I know that this is a real big issue. We have our Indigenous, many Indigenous groups that we've worked to support in the past. It's definitely something that we're keeping our pulse on. How can defeating the virus in these camps help us here in the United States? Okay, that's a great question. Well, I would say firstly, if the virus is anywhere, like in a refugee camp, it's a problem everywhere. It definitely can spread back to the US, the same way we saw it travel from China to Europe and the US. And I would say we need to defeat this virus everywhere. We don't just need to defeat this virus in the United States. We have to defeat it in some of the most vulnerable communities in the world. And that's what we're going to be working to do. Another comment we had on the call is Beyond the Box. Yes, we've really adapted Beyond the Box. ShelterBox was founded 20 years ago, and we have a variety of humanitarian aid. The box is just one of those products, but there are many different aid items focused on the provision of shelter. It takes many shapes and sizes, and it really varies. And yes, we have adapted with something called our shelter kit, which has an infinite number of ways it can help repair a home that's been damaged or create a single room structure. And we are committed to continuing to adapt and bring more value and meet the unique needs of the communities that we serve. And again, it's always different. Okay, what do you consider to be better, wearing gloves or changing frequently, or hand washing? I would say both. The WHO, the CDC recommend hand washing as the first line of defense, right? So first and foremost, washing your hands, having good hand hygiene. and we definitely follow their recommendations and guidelines on best practices. Final question, are SRTs being sent to disaster communities and how are they being protected? Well, right now, the ShelterBox response team volunteers are not being sent to some of these conflict areas we're responding to. We are really prioritizing the safety and well-being of our volunteers to make sure that we are doing no harm to the families we serve and to them. So then, rather than deploying SRTs at this time, we're working through those local partners I mentioned to you. CARE Vanuatu, we're working with Relief Aid in Syria, we're working with Action Aid, AIDA. And so we are working on training webinars to communicate with them on how to scale and how to train on how to utilize the aid. But we are absolutely still responding to disasters. COVID's made it more complex, but our work has never been as important as it is right now. I know we're hitting the time, and I want to say a massive thank you to all of you. I'm so thrilled to see all of you on the line today. It's an absolute privilege to have you here. Thank you for your questions. I would love to hear from you. So please take down my email. Let me know if you have a question, if you have advice, if you have any feedback for us. And thank you so much for participating. We will continue to keep you posted. And thank you so much for supporting the work of ShelterBox. And again, you can learn more at shelterboxusa.org. Thank you so much.